some people, like some communities, when they're breastfeeding, somebody will say one breast is for the husband, another one is for the child.
Hello guys, welcome to my YouTube channel. For those who are new here, my name is Stella Muyoka, and my channel basically is about motherhood journey, experiences in it. We talk about also how we can be able to actually save our money, invest, and also, you know, just basically improve our life altogether. And as always, you can subscribe, like the videos within the channel, and also share. So today with me, I have a guest. I have someone who is a consultant nutritionist, and she's actually specialized in pediatric nutritionist. And today we are going to discuss a topic that is very common, something that we experience in postpartum, and this is breastfeeding. I'm going to introduce my guest and allow her to, you know, be able to share, you know, more knowledge on breastfeeding. So I'm going to let her introduce herself to you, and then we can go from there. So welcome, Wendy. You can introduce yourself, tell us who you are, and we can go on from there.
Okay. Hi, everyone. My name is Wendy Agumba. I'm a clinical nutritionist and a nutrition consultant in pediatric nutrition, as she has said, and I work at Coast General Hospital, and I have a private practice too. Yes.
So Wendy, being a consultant pediatrician, being a consultant nutritionist on pediatric nutrition, and we as mothers, we give birth. I remember when I was giving birth. After giving birth, you know, for me, I wasn't able to breastfeed the first day, but basically, I didn't know how to latch, and they teach you just once. By the way, they show you once, and that's it. By the way, you have to. They tell you, jaribu kurudia jaribu kurudia uone, like if the baby is going to produce milk or anything. So on your opinion, being a nutritionist, after giving birth, how long does it take for a mother actually to produce, you know, the milk itself?
Okay, during pregnancy, when a mother is pregnant, the breasts start forming milk, the milk duct. So when you're pregnant, during the first trimester, you feel your breasts becoming full and becoming heavy. So it starts from the first trimester first. And as it goes, as you go throughout the pregnancy period, when the baby comes out, we have hormones that help help the milk let down. So we have oxytocin, prolactin, and the moment umepewa oxytocin will activate prolactin, because oxytocin helps to stop bleeding, postpartum hemorrhage, and a lot of things. So the moment you've been given the oxytocin, it will activate prolactin, which stimulates breast milk production. So the moment a mother has delivered, breastfeeding should be initiated within the first 1 hour, so that the milk should come.
So I remember you were told just put your baby on your breast. The milk will come out.
Yes.
I remember.
Yes, the suckling reflex sends signals to you, because breastfeeding is psychological. It sends signals to your brain, and then the milk will start flowing down easily when the mother is not stressed out, when the mother is calm. But breastfeeding is not a good experience for first-time mothers.
Why?
It's painful, first of all, because the nipples have never cracked. The nipples have never produced anything. Right now, they're producing milk.
But we use it for other purposes.
So, for the milk to come out, the ducts have to, the nipples have to open. Yeah. So some mothers complain of cracked nipples, sore nipples. Some mothers do not know how to do the latching, attachment, and stuff, because it's a very hectic problem for mothers. Yeah. So techniques for latching are there, how to do a proper latching, how to do proper attachment for the baby, how to hold the baby while breastfeeding. Because when you hold your baby in a wrong position, definitely the baby will not attach very well, and the baby will not get enough milk.
So how would you recommend a new mom,
okay,
to, you know, the positioning of the child during breastfeeding?
Okay, we have different positions for CS mothers, normal mothers, and twin mothers.
Okay.
Yes. For let's say you are a normal mom who has delivered a baby with through spontaneous vertex delivery, which is normal delivery. So let's say this we have this our baby. Here is our baby. I am a mom. I'm a first-time mother. So I'm teaching you how to do the breastfeeding, right? So this is our baby. So the head of the child should be always at the elbow of your elbow here, and then your palm should always be at the buttocks, at the baby's bosom. Yes, and then you put your tummy and baby's tummy facing each other.
Okay.
And then this other hand is for your breast. Unashikilia matiti. 4 fingers down below the breast and the thumb.
Holding on the top.
While breastfeeding, you make sure the baby, the areola, the dark part of the breast, the areola, is inserted
in the mouth.
In the mouth. The nipple and the areola, because some breasts will be coming through the areola because of the pause. Some milk. Yes. It's not only the nipple that produces that milk comes through, some parts of the areola, so that the baby can get sufficient milk. So sometimes you get mothers with big breasts or big nipples. But sometimes mtoto ameshaingiza nipple kwa mdomo, the areola is out. So sometimes you insert just the nipple. So anashikilia nipple hivi with the 2 fingers. Because sometimes you see mothers doing this when breastfeeding.
Yeah, I did that. So
yes. So when you put this finger here blocks the duct that is letting down milk. So the milk is not flowing in vizuri, block the milk veins. So 4 fingers down and the thumb. This thumb helps you not suffocate the baby while breastfeeding. So you just keep on checking.
Especially for mothers with big breasts.
With big breasts. More the baby has latched. So something that makes us know that the baby has not latched, they produce a sound while breastfeeding, which means they're getting air into them. So when the baby is breastfeeding, it should create a vacuum between the mouth and the areola. There's no space, so that there's no sound. For twin mothers, sometimes we advocate for pillows. You put our baby this other side with the legs facing behind, this other baby also the legs facing behind, and then you place them like this. Yeah, and this other side. For twin mothers.
And for CS mothers.
For CS mothers, you can use the pillow too because of the site, the CS site. You can use a breastfeeding pillow that is more comfortable. It will help you raise the baby above your tummy because of the pressure. Don't put pressure on the wound. Yeah. So you just do the same technique, or you can do while lying down for CS mothers while comfortable. While lying down on your side, you make sure that the baby is also lying on the side when you're breastfeeding. So
now we've learned how we can, now latch our baby. So after we've, done that, how often should someone actually, after the first time you breastfeed mtoto, how often should you breastfeed your child? Like how can you space it out for like a newborn, and then we go to 6 months, and then we go to a toddler? Okay,
breastfeeding a newborn should be fed on demand, because at the beginning their tummy is very tiny. So the moment they pass urine or they poop, the stomach is empty.
And how can you know?
You breastfeed on demand.
Like how can you know your baby needs to breastfeed?
There's something that most people don't know about, how to know when your baby is angry. The older babies will be fussy and irritable and stuff. Sometimes a little baby, you might not know that the baby is angry. But the moment you've seen the baby has passed stool and the pamper is fully mejaza mkojo, definitely that is somebody they can't communicate for themselves. So you just have to, on demand, or roughly after every 3 hours. Yeah. Okay. Sometimes 3 hours could be longer.
Even 3 hours could be longer, shorter.
Yeah, but now you just make sure you breastfeed on demand, because for newborns, they make sure that they get the first milk that comes out within the first 3 days, the colostrum, the creamy one. Yes, it is very, very good.
Of that colostrum, because I think most people don't know. And how can you tell this is colostrum and this is just the normal breast
most
milk?
Mothers, they'll tell you, maziwa yangu inakaa kama maziwa imeganda, ama inakaa kama inakuwa manjano, which is yellowish. I was like, mami, hiyo maziwa ya yellow ni muhimu kwa mtoto. Colostrum is the first immune component yenye mtoto ana get in contact with the infant. So it is one of the best components of breast milk that the baby should get at first, within the first 3 days of birth. So you make sure that your baby amepata the whole of it, because it has all the antigens, immunoglobulin, all the rich in protein, fats and everything that the baby needs.
To actually fight any
Yes, fight
infection.
any infection. That's why you'll be told it's sufficient for the baby for 6 months, the breast milk. It builds a very good immune system for the child to combat a lot of infections, homa, here and there, flu, cough.
But the flu is what? Flu is the commonest.
Yes, for babies who are not exclusively breastfed, visits to the hospital are more. So babies who have been exclusively breastfed, they're more, the weight gain is consistent, their immunity is perfect, they're not sickling, and they don't have delayed milestones unless they're preterm babies. Yeah.
And then now,
or syndromic babies.
How long should actually someone breastfeed a child? Like, what is the recommended
time?
Like, can we go 6 months and stop, or maybe a year?
Yeah, no, recommended time, a baby should be breastfed by up to 2 years.
If you can, or is it
if you can. If possible, you can breastfeed up to 2 years.
Because my son refused breastfeeding 6 months, he was done because I wasn't getting.
And then it's supposed to be the first 6 months, the baby should be exclusively breastfed with no any other feed, and then you introduce complementary feeds.
And in conditions where maybe there's some mothers who don't produce actually milk.
Yeah.
Maybe little or maybe at all milk. So what in such kind of cases someone cannot be able to exclusively.
If a mother wants to, she feels like she needs to exclusively breastfeed. There are those period when you give birth, your baby is very sleepy, like a young child, mtoto mdogo kabisa, like day 10 to day, like let's say from day 0 of birth to day around 2 weeks, the baby, most of the time they sleep.
Yeah.
So my advice to moms is, most of the time when your baby is not sleeping and at that point you have milk. Some mothers express and pour out. You can express and keep, because it will come in handy later in life, or later as the baby grows. Because the more they grow, the more the demand comes up, because they're also growing very fast. So when your baby is sleeping, take advantage of that and express. I know motherhood is a very tough journey, because sometimes you need to rest, you have work, you can pump on the go.
You find a way that works for you.
Yeah, find a way that works for you, but make sure that you are exclusively breastfeeding. That is what I always advocate.
I remember sometime I came in contact with someone. The child they didn't breastfeed the child, because the myth where my boobs are going to
exactly
are going to follow. They're going to fall. The Tonga fallen soldiers in such cases, and you find that actually women make the choice not to breastfeed their child. There's some women who have made that choice.
Yeah.
I know, but also there are those women who actually, are there people you've met that actually are not able to breastfeed their child, that they're not producing the milk, but maybe the milk is little, and they cannot really exclusively now breastfeed a child. Yeah,
I have met a couple of clients who say some choose not to breastfeed because maybe they're HIV positive and they don't want to endanger the child. However, HIV moms are allowed to breastfeed, because the baby is also put on medication for the first 6 months. But you'll find the mother says she wants to be cautious. She doesn't want to breastfeed the child, or expose the child, the fear of unknown. Or maybe, what if I make a mistake during breastfeeding or something? Yeah, you find most of them resort to giving infant formulas, because sometimes they have to feed the child, because you can't give the child anything else. Yeah. So you find sometimes it's very sad that they choose not to breastfeed. Or for mothers who produce little milk, we have remedies that work, that help them now and then to produce milk. We have some supplements that always help in the market, that always help them to produce more milk. Yes.
Yeah. Okay, we have a lot. We have a lot. So what do you think are the common challenges that people face during the breastfeeding journey? Especially, I think the first 6 months is where we struggle a lot.
Yeah, okay. For first-time mothers, I can say patience. They're not patient enough with the child, because sometimes the baby could be having colic. The baby is very fussy, very irritable, and your nipples are sore, and your nipples are full. Your breast is full. You feel like this milk should just get out of my chest. But the baby is also sleeping. Take your time, pump the milk and store it. Another problem that people face, the sore nipples, cracked nipples, engorged breasts, infection to the breast like mastitis, some blood stain. It's a bacterial infection that affects the breast.
So you end up pumping
with blood stains. Yes. For such cases with mastitis, we advise the mother not to breastfeed until the blood stain clears off.
You breastfeed, am I?
No, you don't. You stop.
Okay.
Because the infection could be passed to the child. Yes, because it's a body fluid, and anakunywa.
And those with sore nipples.
Those with sore nipples. Breast milk has fats. Don't apply any OSG nipple cream, OSG mafuta ya nazi, OSG arimis. Breast milk has components. It has water, it has proteins, it has fats. So the fat that is there will help you make it not to be dry for a very long time. But the more you breastfeed, the more the soreness goes away.
So you keep on.
But when the nipple is more sore and you feel it has some reddish at the base of the nipple, make sure you get help from a doctor, because sometimes you could be working with some infected nipple that is not mastitis.
So who do you go to, by the way? Because
you go to a physician or a gyna.
With the breasts?
Yeah.
Not a dermatologist?
Not a dermatologist, no.
I would have gone to a dermatologist.
You go to a gyna or a physician.
Okay.
Yeah.
We've talked about the various positions and how to actually be able to... The most common challenge we get women is producing less milk, maybe. And this can be caused maybe due to, maybe you overbled during birth, or maybe you got dehydrated during the whole process of birth, or maybe you're just, sometimes we get stressed. We go through postpartum depression, and we can't be able to now produce enough milk for our babies. So how do you think we can, what do you think we can, someone who's actually feeling like they're producing less milk can do, they can be able to do to actually produce more milk?
First things first, breastfeeding is psychological. The moment you are stressed out, your milk production will be low, because your stress hormones are working against your breastfeeding hormones. Yeah. Yes. So the moment you are stressed out, your prolactin levels will go down. Definitely you won't be producing enough milk. So first things first, clear your head. Psychologically be prepared to breastfeed. The moment you're psychologically prepared to breastfeed, your hormones will come into place. Another thing, what are you eating? Are you getting enough fluids? Are you eating energy-dense foods? Are you eating protein-rich foods? Because milk is 100% protein with little lactose. So what are you eating? What are you putting in your stomach that is not giving you enough milk? So your diet first. You check in your diet and your stress levels. Are you stressed out to the point that you can't breastfeed? Because sometimes you find mothers going through the postpartum depression, and then antidepressants, they sometimes they cut off your milk production, kabisa, the side effects. So what are you doing about your stress levels that can't, if you're on some medications, you can't breastfeed, if you're on some, so what, like cancer mothers can't breastfeed because of chemo, patients who have hepatitis A, liver conditions are not allowed to breastfeed because of the medications. So what are you doing that is not making you produce enough milk? What are you not eating? Are you stressed out so much that you can't breastfeed? You can't just put your mind to breastfeed.
So basically just
evaluate yourself first as a mother, because for you to become a mother, you have endured through a lot. Yes, giving birth a child, it is work, yes, but now the journey of taking care of a young human being is starting, which is more hectic than the previous part. Yes, so this is a human being who is looking, everything is you, from birth to feeding, which is exclusively, yes, it's to you. Going to the toilet, but everything is the mom. So you have to be strong, you have to be very patient. Patience is very, very key.
Even because for late nights and
for late nights you need patience. You need a lot of patience because you can be exhausted. The baby is fasted all through the night, all through the day. You haven't rested.
So what foods should someone, there are usually a lot of talk, when you take this food, the kid is going to get, your child's going to get colic, such kind of conversation people have. So like, what are the foods, like examples of food that we can recommend someone to take during the journey of breastfeeding, and what foods can someone avoid? Okay,
first of all, for a breastfeeding mother, you should eat at least 7 times a day, 6 to 7 times a day.
We don't want to add weight.
Definitely, you've added weight already during pregnancy.
There is another
And then
fear.
there is also weight for lactation.
Yeah.
And then this is something that mothers don't know, that the moment the baby, sometimes when you are when you are mentally prepared for losing that weight, you lose it.
Yeah, you lose it.
Yes, because the baby you won't be eating as much as you were eating before. Yes, because so you need to be eating 6 to 7 times a day. The least is 6. Let's say 5 to 6. Sometimes some people cannot be. Affordability is also another problem. Yeah. So you need to be eating roughly around 5, 6, 7 times a day, with a lot of fluids in between, because breast is 90% water. Yeah. So with lots of fluid, and then you also need fluids for yourself as a woman, for your UTI, for your system. You need that water, a lot of water, and a lot of probiotics, so that you don't get UTIs here and there. So you need to eat more of energy-giving foods. We have the carbohydrates, we have proteins, we have fats, we have mineral, we have vitamins, and we have vegetables and fruits. Definitely, you need to eat from all the groups that are available, but how you spread it.
So actually, there's no food you're supposed to avoid unless you're allergic to.
Yeah, unless you have allergies to it. But caffeine, you don't. You limit your coffee intake, because coffee, babies can't. Yeah, it passes through the breast milk. Anything that you eat portrays through the breast milk. If you are a mom using alcohol, it goes direct to the breast milk. Whatever you digest, whatever you get in, it gets out through the breast milk to the baby.
On that point, on alcohol, how long does it actually stay in the breast milk?
Alcohol stays in your body for 21 days. Yes.
You want to tell me that
the moment you take
told that, I don't know, 24 hours.
No. Any drug stays in the body for 21 days.
So we cannot say like, I can take this now and then 6 hours later I can breastfeed.
No, it's not allowed. It's not.
Women do that.
Yeah, women do that because it's the lifestyle that they choose. Yeah, so you need basically to be eating energy-dense foods. There's some spices that when you eat could pass through the milk, like garlic and ginger. They reduce the quality of milk production. The milk becomes much lighter. Like it becomes more runny and more watery because of the chemical component of garlic and ginger.
Yeah.
So most mothers are advised not to take ginger and garlic when you're breastfeeding. And a lot of spices, mostly. Yes, mostly the artificial spices, and mostly the ready-made, let's say the juices, mostly that have preservatives.
Or like the packed ones.
The packed juices, yeah. That are not necessarily advisable during breastfeeding.
Oh yeah.
Yes.
So what can be if I'm breastfeeding, and what signs can I know that my baby is getting enough milk?
A well-rested baby is getting enough milk. A sleepy baby is getting enough milk.
So a fussy baby is
not getting enough milk.
And
you as a mother, you will also know that my breast size is reducing, which means your breast is not producing enough milk as before.
But then, actually after you stop breastfeeding, it goes back.
Yes.
It goes back to being
That's why it becomes more flaccid. Inakuwa kama zile socks zenye watu nasema. Fallen soldiers. The sandy socks. So the more breastfeed, if you stop breastfeeding, definitely don't be producing milk. Yeah, the expanded meat will fall down. The muscle, it's a muscle. It shrink.
How can someone actually? We know nowadays after the incident of Olive Inn, where a mom was breastfeeding, in public, and they were thrown out because she wasn't covering up. How can someone actually be able to manage in breastfeeding in public?
Breastfeeding is not a crime.
I know it's not a crime.
Yes, you should breastfeed whenever you want, whenever you want.
And according to
feel comfortable with it.
Yes.
Me, I'm somebody who can. When I get a child, I will breastfeed. Hata kwa matatu. I'll breastfeed. But I feel comfortable. You haven't seen mothers with babies crying every here and there, anatafuta mali ya kunyonyesha, ati siwezi nyonyesha hapa. Mom, sit down and breastfeed. Mom, assume that they're not there. But you're well covered with the child and you're not exposing your breast to the public. Yeah, sit down. Why not breastfeed? Because sometimes people will be like, your baby is making noise. Like, the way some people are always.
I know, actually when a baby cries, if you're in a matatu, a baby can be well breastfed, but mtu analia, unaambia mama nyonyesha mtoto.
Yes.
People say such kind of things. Nyonyesha mtoto.
Exactly. Yeah. So be comfortable to breastfeed whenever you can.
Yeah.
Now.
Oh, why we have unpacked anyway. So, what are the common myths? Before we go to the myths, by the way, what is the benefit actually of breastfeeding to the baby, and what is the benefit of breastfeeding now to the mom herself?
Okay, to the baby, we call it white gold. The baby gets food from it, builds immunity from it. The baby gets all the nutrients they need for the first 6 months from it. The baby gets water from it, because breast milk it is divided into, we have fore milk and hind milk. First, most of the time you'll find the first milk is fore milk. It is more watery. Yeah, it quenches the thirst of the child. Then the hind milk is more heavier. It's more whitish, so it has all the components. That's why when you're breastfeeding your child, don't keep on changing. 1 minute, one breast
Until
10 to 30 minutes, until the baby comes out of it, literally. Then
actually
come back to this other side, because you can be moving this child asha kunywa maji ya huku, ukimbeleta huko atapata maji. So this baby will be just full with the fore milk, which is not that much enriched. So make sure that the baby is amejitoa mwenyewe kwa matiti. Yes.
Okay. And what is the benefit of now is to
the mother? To the mother, it helps. The more the baby suckles, the more the uterus goes back to its position. Contracting of the uterus. Yes.
During the first, especially the first. I didn't know it has an effect.
The more the baby suckles, the more the uterine walls shrinks, goes back to its original space. Some people say it's a method of family planning, but I haven't. I don't know.
That.
I don't, because of the hormones on stuff. Because during that time estrogen levels are a bit, I can't say, but
some still
get pregnant during that period. So to the mother, it's also a way of bonding with the child.
Yeah.
The more you breastfeed, the more you come close to the child. It's true. It creates a bond between you, and then the baby will know your smell. Even if you're not there, mtu amembeba, this is not my mom. Yeah, so it creates a very good bond between the mom, the child, and the child.
And what are the myths of breastfeeding? Myths tukonazo kunje. What we miss the misconception tutasemanga tu kunje about breastfeeding.
Some people, like some communities, when they're breastfeeding, somebody will say one breast is for the husband, another one is for the child.
There's that story again where men.
That is what I've really heard a lot, but I don't know about it. Why do you breastfeed your husband?
You know, like, do you remember there's a story that was running in the internet? I don't know, it was in Uganda, where men were fighting with babies over.
Yeah, it was in Uganda.
Over breast milk.
Why would you? This is a child's feed.
That is what.
Okay. Anyway, breast milk is very nutritious.
But does it actually benefit the men?
I have no idea what adults are benefiting from breast milk, but they're grown adults with the teeth and can eat and can chew. Why would you fight for
breast
milk?
You see, we've been told, like, men are selfish. Men are selfish. We've been told that it's, the immune, so there's even one boda man who was being interviewed and he said, inamfanya nakuwa, strong.
I know.
But I think it's amazing.
It's a belief that they have in their head. Yeah, but I would advocate. Why would you fight for breast milk for the child?
For me, I think the family planning thing is also kind of like a myth, because to me, I feel like it is kind of like a myth.
Because the moment, during that period, the postpartum, you are given around 6 weeks before you go to visit a clinic and put a breastfeed, family planning method of choice that you'd want. But now,
because I feel like,
during that time, your hormones as a woman are all over the place.
They're all over the place.
Yeah, so I can't say I don't know how it helps with
I don't think. I just feel like the cycle of someone, maybe, the people will take a while for them to actually get their menses back. For me, I got to the first, 1 month I already had gotten my menses, so I don't think even breastfeeding will have worked at as a,
exactly.
I think there's other things, not breastfeeding.
Breastfeeding at all, yeah. But maybe for people, what kitambo it used to work. I have no idea.
So how can someone involve actually their partner in breastfeeding? Like, I have someone who's the father of my child wants to be more involved, in the care of the child. So how can I actually involve the members of my family or my partner in the breastfeeding process?
First things first, they should always give you that space, and make sure that you're not stressed out.
Yeah.
So when you're breastfeeding, they could make a very good environment for you to be calm, not noises everywhere. Get a calm space, go breastfeed. After breastfeeding, they could always take the baby for you after you breastfeed. You also rest. So the support comes in when they take the child, or when you're breastfeeding and you're feeling pain, somebody could always be there to hold your back. Yeah. Some mothers cry when they breastfeed. Because when you're breastfeeding for the first time, your nipples are very painful.
It's very uncomfortable, actually.
Someone could always be there just telling you, it's okay, you'll be fine, it's just a matter of time. You know, that one will make you feel like, at least I'm supported. Somebody here is checking out on me. As I check out for this little one, somebody here is checking out on me. Yeah. Always be there physically, emotionally, emotional support, financial support. Wanunulie chakula wakule vizuri.
I know, but I also feel like the bottle feeding, they can do that when maybe you've pumped,
Yeah, they could do. I don't advocate for the bottle feeding.
I know.
Yes. I would advocate for spoon and cup.
Yeah, spoon and cup
or
is what
cup.
you go for.
Yes, because of the bottles. They're made of silicone. Thrush all over the baby's mouth. We'll be fighting thrush, and so at some point it makes the teeth, the development come late, because and then babies on a bottle will always be in a bottle. They will not learn how to chew. They will not learn how to eat by themselves. They won't learn how to be independent. So this notion of bottle feeding should be just, the government just
cancel. But I think there's some recommendations. Nowadays, when you give birth, they actually don't allow.
This bottle feeding, most babies who are bottle fed, first things, oral thrush is very recurrent. Thrush it interferes with the baby's appetite. The baby won't be feeding. That is interfering with weight gain, development of the child. Yes. And then another thing, teeth development. Because this baby has milestones that he needs to cover. So inafika pati ya kumea meno, hazitoki. You're worried but what you've been doing as a mother, hujui umekuwa ukifanya nini? Kumbe umekuwa ukipea mtoto maziwa na chupa.
Most of us don't know, by the way. We've seen it over the years. We just know.
And then some others will be like, my mom used it. Your mom and you are different people from different generations, and you're raising different human beings.
It's true, by the way.
You and your child are not the same. Your child might be 50% you, but your child is not you.
It's not you, baby.
Exactly.
And actually, kitambo, the environment has changed and everything.
Everything, dynamics have changed. Everything has changed.
So we've reached. You've given us, by the way, strategies of how to breastfeed twins. I didn't even know actually about that. I mean, I don't go moja.
And then each twin has a breast, because every other twin have different tastes and they know how to choose breast.
What if you have like triplets, by the way? What happens?
Okay, so you express. Now this is where you come to express. Because you can't have 3 breasts, you have 2 breasts. For triplets, you just express the milk and then you do the cup feeding. But sometimes you'd put them all of them for breast and they will stimulate. Because sometimes you can be expressing milk and hytoki, but with the suck of a child, it stimulates your mind.
But other than breastfeeding, pumping actually is also painful. I think I struggle with pumping.
It's painful, yeah. Pumping and latching are more or less the same.
But
when you do it wrongly.
For me, pumping was a bit.
And then sometimes you're using the wrong pumps. You're using the manual pumps.
Okay, use the manual pump.
You'd be very tired.
And then there's a very painful feeling when you are pumping something.
Yeah, and then you become. It is involving. So
you actually recommend the electric one?
I would recommend if you can afford it. Yes, because you just seated, you're doing other things. You're just putting those shells, those breast milk shells that store breast milk. You just walk with them around. You can do that when you're driving. You can do that when you're doing your chores at home. You can do that when you're doing your work at your workplace.
But for me, I feared. I think it's just out of lack of knowledge. I feared the electric pumping.
It's one.
Why? When we milk our cows with the electric ones outside at home, and you find that maybe there's a strain of like a blood stain. So I had the same thought with. Now I'm just telling you.
I have a friend, a very close friend of mine, who used an electric pump, and it was like she was just seated and working from home and pumping
at the same time,
marking the bags for storage, storing, pumping for when the baby was sleeping, she was literally pumping and working.
I didn't know. Now I know. Actually, I never knew that. Let me just
and then that pump, it's set with time. So like it's pumping for 20 minutes, giving a break for 5. Because with that pump, and then she was like, I'm very thirsty when I'm pumping, which means it's making your body to drink more water. Yes, so she was pumping like around 4 times in a day, very early in the morning when she wakes up before the baby breastfeeds, so that she can get more milk. And then after breastfeeding the child, she would, during the day the baby is sleeping, anytime she would get to pump, she would pump. When the baby is sleeping, she would pump. And she had a lot of milk storage.
But when you're putting on the shells, is there a way? Does it, like when you put? Is there a specific way to put them on? Like ukieka inakuja in the same direction, the comfortable one, or you have to know how to
No, you have to know. You have to know how to place the shells.
How are we supposed to place the shells?
We don't have the shells.
I know you don't have the shells.
You don't have the shells.
But like you can just give a description of it.
Like they are shaped like the way the nidhi is. So there's a hole where the nipples goes in through the nipple and at the areola part. So it attaches and creates a vacuum.
Yes, a vacuum. Yeah.
So when it touches vizuri, it will, when it's pumping, you'll feel it's pulling you. It's pulling off the nipple since the baby is suckling. So but when it's attached wrongly, it will be slipping from the nipple. Which means the nipple is not in the position.
It is going to be painful a bit. Yeah. Okay. So what are some resources and support groups available from breastfeeding? Because I think we don't, as Africans, we've not like come up with it.
There's some organizations that have, let's say at your workspace, they provide a room where all breastfeeding mothers go.
Usually that can give you support.
And some churches, they do have this groups for breastfeeding mothers that they check on each other for new moms. So the older moms encourage the younger moms. So they usually have meetings after the church or when you're meeting over lunch. Safaricom they have they do have a breastfeeding support for the breastfeeding moms because wataka huko during lunchtime. They are given lunch. The breastfeeding moms are given lunch, and then they breastfeed. They bond over that time. They share their experiences through breastfeeding as mothers. The challenges. So this is an initiative that most organizations should be having. Mostly, let's say the working spaces, so that the mothers could be more productive. Because most babies wakishanyonya moja, they'll be like sleeping. For the small ones.
Yes.
And
then I remember when I was producing the little milk. Is it advisable actually when I pump at 10 and I pump at 12 nani kidogo? Can I pile them up or just store them?
You don't just store them differently because these are different milks. It's coming from different times. Yes, because as unaweza kuwa pump ile ya kwanza it's water. Then mtoto anyonye kidogo then uanze kupump kingine ikuwe more thick.
Maybe I used to balance. Mimi nilikuwa na balance.
But some people usually mix them. But you can mix them. You can mix, but it's not advisable. It's advisable.
Anyway. So basically, I think we've covered actually so much on it. I don't know if there's anything we've actually left out, by the way. So if you are to just advise a mom who is starting out their breastfeeding journey, what is it that you would feel like we've not? What would you feel like you can just tell this mom,
Okay, as a young mom or a new mother, you are just learning you just received the child. You are so happy, so excited, Be patient with the child. Be patient with yourself because you're also learning. Nobody is going to teach you to go through motherhood. Nobody's going to make sure your partner is supportive, please. Whenever he's not there, please just shout and cry and do everything that you can do so to get the support. Because you could be crying and you're injuring yourself. That is how people sink into depression. Yes, get help when you need it. Be patient with your milestones as a mother. Not everything will turn out as other mothers. Your baby could be a special baby. Your baby could be a miracle baby. Just be patient with them. Just take your journey as it is. Don't look for examples in other moms. When you need help, look for a professional. If you don't know something, please don't assume. It could be injuring you and the child.
That's true.
So just be patient. Take your time. Take your time with everything, with yourself, with the child. Take your time with everything. And please exclusively breastfeed. Because it is very, very important.
Yes. All right. Thank you, Winnie, for taking the time to actually, share your knowledge knowledge is power anyway.
Yeah.
So guys, as always, thank you for being here with us. As always, share, like, subscribe. You can always leave your comments down below, and there's so many videos on tips on motherhood and the journey within the channel. So thank you. Bye bye.